The last lecture focused on early conceptualizations of mental illness. In this lecture, we're going to continue that conversation and move to talking about how institutions or asylums shaped the conceptualization of mental health. So, just as a brief review, remember that historically there have been two main theories about the cause of mental disorders. Either that they were caused by spiritual or demonic possession, or alternatively, that they were organically caused. And that's been the case basically since ancient Rome and ancient Greece, so from about 500 BC onwards. But understandings of mental disorders were often complicated by social and political movements or events. So if you remember, at the end of the last lecture, I mentioned that during the Renaissance period, so in the 15th and 16th centuries, one of the reasons people were accused of being witches was because they experienced mental health symptoms. And according to the thinking that predominated at the time, it was presumed that those symptoms, and therefore witchcraft, was caused by demonic possession. Because of this, the treatment for mental disorders focused on ridding the body of spirits, which often involved physical punishments, so the body was made intolerable for those spirits. One of the key places where this type of treatment, and I put that in quotation marks, took place was in institutions. Now, these institutions, which were originally designed to house patients with leprosy, ended up being converted into what they called lunatic asylums during the Renaissance period. And unfortunately, the treatment within those asylums was often just as torturous, if not more so, than what was being done outside the walls. Bethlehem Hospital was one such example. Bethlehem Hospital was founded in 1247, and for the first 200 or so years, the hospital serviced typically just a handful of patients at a given time. Many of these patients may not have been suffering from what we would now consider to be mental illnesses. It actually wasn't until 1377 that the hospital became primarily known as an asylum for the insane. By 1460, however, Bethlehem Hospital, which was colloquially referred to as Bedlam, was known as a specialist institution for the confinement of the insane. Just because the hospital was primarily responsible for housing those with mental illnesses didn't actually mean that much was known about how the residents of Bedlam should be treated, however. So throughout the 15th, 16th, and even 17th centuries, the treatment was often brutal. And the reason for that was because the general belief of the time was that if people were going to act like animals, then they should be treated like animals. As such, beatings and floggings were actually really common. As one scholar noted, patients were confined in badly ventilated apartments where they were never discharged but by death. The quiet, the noisy, and the violent were all congregated together, and a majority were chained to beds by their wrists and ankles. No contemplation of human misery ever affected us so much. The howlings, execrations, and clanking of chains gave to the place the appearance of the infernal regions. Now, also contributing to the inhumane treatment was the fact that throughout the 1600s, Bedlam became overcrowded with no division between the sexes or types of illnesses. In addition, as different individuals were put in charge of the hospital, many of whom had no training as physicians, it seemed that various treatments were also implemented. For example, over the years, we have evidence that various forms of confinement and sensory deprivation were practiced. In addition, rotational therapy was also used, in which the patient was spun around in circles, often for hours and hours at a time. Now, remember that none of these treatments had any evidence behind them in terms of their effectiveness, but ethics were a little lax during that time period, and people were just trying to try anything to reduce symptoms. One other interesting thing to note is that after Bedlam moved to a new structure in Moorfield, London, Bedlam became a tourist attraction where people who paid a penny could observe and provoke lunatics for their own amusement. And it wasn't until the 1700s that these quote-unquote lunatics were actually considered patients, and as such were provided with oversight from a physician. So as we enter the 18th and the 19th centuries, we enter what was considered the moral era, which was the beginning of modern psychiatry. During this time, and because of increased reliance on organic theories of the causes of mental illnesses, patients became less regarded as animals, demons, or sideshows, and finally began to be seen as human beings with dignity. So this is a painting titled "Pinel Frees the Insane from Their Chains," which was painted by a French artist named Tony Robert Fleury in 1876. and the painting depicted the French physician Philippe Pinel supervising the unchaining of mentally ill patients in 1794 at a large hospital in Paris. So we see these changing attitudes about insanity and mental illness in general, not only in Europe with the passing of the County Asylums Act in 1808 and the Lunacy Act of 1845, but also in the U.S. Now, in the U.S., abusive practices in mental health asylums were called into question by one woman in particular, Dorothea Dix. Dorothea was an American activist who, after being introduced to the moral treatment movements in England, started lobbying state legislatures in 1840 for better and more moral treatment of those with mental illnesses. As a result of her efforts, the first generation of American mental asylums were established that replaced the rather haphazard and often abusive treatment of the mentally ill throughout the beginning of the 19th century. These reforms persisted until the American Civil War, which ended in 1865. But after that, asylums found themselves inundated with servicemen suffering from soldier's heart, which we would now call PTSD. As a result of the number of affected men, asylums became overcrowded, resulting in a backslide in treatment. And so we saw a return to the use of restraints, but also saw the introduction of new treatments like opium, which kept patients sedated for long periods of time. One good thing that grew out of the overcrowding, however, was the creation of new asylums all over the country. And many of these were designed by Thomas Story Kirkbride, who was a psychiatrist. And Kirkbride, thankfully, was a proponent of moral treatment. As a result, he designed his asylums as communities that had beautiful buildings and campuses, provided social and recreational activities, promoted a self-sufficient community where patients would participate in growing food and doing laundry and cleaning. There was also an emphasis on having adequate food, which, maybe not surprisingly based on what I've said, had been a problem in earlier asylums. Kirkbride's asylums were also exceedingly clean, and there was a lot of supportive staff. But there was trouble on the horizon again. See, because asylums began to be known as more or less lovely places, they began accepting many patients without any clear criteria for accepting or rejecting patients into care. As a result, populations in asylums across the U.S. skyrocketed again in the early 20th century. For example, in one asylum in Ohio called Athens, the patient population rose from 200 to 1,800 in a relatively short period of time without any significant alterations in staff. Because of this, patient care began to suffer yet again. As a result, there was another return to tried and true methods of patient containment like restraints. But other new treatments were tried as well. In the next video, we'll talk through some of those new treatments.